Greetings, everyone. My name is Ivan Duran. I'm the proud superintendent of the Bellevue School District. Today, I am joined by Carrie Lang, our Director of Special Education and Health Services. Today, we'll be spending the majority of our time talking about vaccination clinics here in Bellevue. Welcome, Carrie. So,
Hi.
Carrie, first, I just want to start by saying, on behalf of our students and our staff, thank you for your leadership throughout this pandemic. You have truly just have done extraordinary work, and you have truly been exceptional during this time. We're so used to always doing just amazing work, and over this last year, you've just done exceptional work. So thank you. So I just want to take this moment to thank you for your leadership and providing vaccination clinics for the district. You've been planning, organizing, and implementing so much work in the background, to get these clinics set up, from the very beginning. And this is a very important project, for many, many reasons. So I've had so many people tell me that you deserve a medal. You need to be, especially recognized, so this is one small way, that we can do that now. So I just thank you. And if we were in person, I promise you the next time I see you, I will give you one of our values pins around excellence, because you have just been doing excellent work over this time. So thank you. So I'd love now for you just to talk a little bit around, share a little bit about your process, the work that you have done to create more partnerships, here with our community, and just everything you've done to work with, the pharmacy and different providers, so that we can get our staff and educators vaccinated. Just what have you been going through, and what have you had to do to get that all set up?
Yeah, thanks, Dr. Duran. It's really been just an amazing experience to get the opportunity to put together these vaccine clinics. It's been a lot of work, but I've had a lot of help. So, back when the first vaccine phasing guidance came out in the late fall, members of the nurse group and I started reaching out to some of the pharmacies and community partners that we'd worked with in past years to get vaccines in our district, whether it was flu shot clinics for our staff members or vaccines for our students. And also some other pharmacies and community groups reached out to us to talk about partnering for vaccine clinics. So this started the ball rolling. We started talking about logistics, location, how would we reach out to staff, how would they get their vaccines to us, and other kind of details like that. So we'd done a lot of pre-work before we were able to hold our first clinic, and that first clinic actually came about because SEIU, which is one of the unions that represents many of our school district employees, including our paraeducators, our bus drivers, they were working with Safeway Albertsons Pharmacy and knew that Safeway had about 600 shots of Pfizer vaccine that they could offer to us. So we were able to partner with them really quickly and turn around our first vaccine clinic, which we had on February 27th. And that vaccine clinic was so successful. We were able to vaccinate just over 300 of our staff members who were eligible under that phase. And it led directly to us being able to have our second vaccine clinic. Safeway was able to get a hold of 600 doses of Johnson & Johnson vaccine right after the governor had put our educators into phase 1B1. So within a couple of days, we were able to turn around our second vaccine clinic, where we were able to vaccinate just over 600 of our employees, which was just really amazing that we were able to turn it around that fast. And I know we could not have done it if it wasn't for this side-by-side partnership that we had with so many members of our community and people in our district. So we had the Safety and Security Department. They partnered with us on logistics and operations. We had human resources support to find emails and phone numbers of our staff members so that we could reach out to them to let them know how to sign up for the clinics. We had members of our facilities department who were able to get us PPE and other supplies right away. Our copy center spent hours creating all of the hundreds of photocopies of paperwork needed to be able to support running the clinic and support Safeway and the paperwork that they needed to do. Our custodial department was there, of course. They helped set up and clean up, and they help provide disinfecting support right there on the days of our clinics. And our nursing department was there. They came both of the clinics and spent their time monitoring people after they'd had their shots, as well as providing post-vaccine teaching, answering questions, and just helping people to feel comfortable after they'd gotten their vaccine. Also, Bellevue Fire Department sent two of their first responders out to us, so they were able to be there just in case we had any health concerns in the staff that we vaccinated. They were there to provide support, and it just made everything go so smoothly, and it was so rewarding to be a part of that collaborative work.
Wow, that's really great. Just hearing that, you just realize how many people were involved in the process to make this happen, and so I'm really grateful for that. And I was talking with the director from Safeways, on Saturday around the work, and one of the things he just said was that he was so grateful for just the partnership and that it's been so easy because they don't always have the same level of support. So just hearing that list of people that went through to support this really does demonstrate, that it really does take a lot of different people involved to really accomplish something like this. So it's really wonderful. I'm also really grateful too. I didn't realize that SEIU Union had kind of been our first contact with them. So really appreciate their leadership. I was there at that first clinic, and it was just impressive to see such a wide range of people there, and people just really, really grateful. I'm still reminded, I saw Art Griffin, one of our bus drivers who was there, and he was just so thankful for that, and just, couldn't believe that, we had prioritized it, we had made it happen. So again, it just really speaks volumes to the amount of work it takes, and just when we come together, we can really accomplish some great things. I think it's really important too, as as the vaccination comes out and we have this opportunity that this is just another layer in the risk mitigation strategies that we have put in place, and that really needs to be in place as we move forward. I keep reminding people that just because we're getting the vaccine, it doesn't mean you don't have to wear masks. It doesn't mean you don't have to be physically distanced. This is just another layer in the strategies that we have in place. So I think it's going to be important for us to keep reminding people about that work. All right, so I want to shift a little bit, because during this time, your examples around how staff have come together is just wonderful. But I've also heard that there's been some other ways that staff has come together to share resources, different kind of information, encourage each other. I've heard from many of our staff members that, once they come to the buildings and they see all the different mitigation strategies that we have in place, it provides some comfort as they start to hear from other people that, in their experiences. It just helps to kind of understand that, we really have done a lot to make sure that, we have limited, risk as much as possible. But someone shared with me something about the Somerset elementary educators who came together in a unique way. They made it fun at what could have been a really stressful time. Do you remember that? And can you share a little bit around what your experiences with the Somerset educators?
Yeah, absolutely. So a group of Somerset paraeducators and our general school assistants came to the clinic this past Saturday to kind of, be there in solidarity for each other, to get their shots and then really celebrate that they were able to do that. So, I was able to kind of greet them when they came in. We had all kinds of volunteers there at our clinic, from paras to family engagement staff to, of course, our nurses. We had OT-PTs who volunteered. We had school principals, school secretaries, everybody in between. So I met them at the door right there. We do a health attestation for everybody who comes in, so that, again, like you were saying, one of those risk mitigation strategies that we're putting in place, so everybody, can attest to whether they have any symptoms or not. We take people's temperatures. The volunteers were helping with that. Then we help people to get in line with the pharmacists who check people in. Then people are moved along to the next set of pharmacists who actually give the doses, and then out into the waiting area. And that's where I connected back with the Somerset staff, check in with them, see how they were doing, get their feedback on the process. They're really encouraging each other, and they wore their Somerset Pride t-shirts to come and celebrate the event. And then I met up with them again afterwards, and when they went outside, where they posed for a lot of really fun pictures, just to show, they posted on social media and shared with their peers, these are the things we can do to support bringing in-person learning and face-to-face learning back with our students in our schools. And I've seen that same spirit in a lot of our schools and staff members across the district.
Yeah, I agree with you completely. That spirit has definitely been there. And I actually do have, I'm going to actually read this. I do have a little quote that came from one of the Somerset educators in an email that was sent to our staff. So I'm just going to read this. I think it's really appropriate to read. And again, I think, a moment to recognize you, Carrie. So we felt very lucky to be able to be vaccinated as fast as we were after the announcement from Governor Jay Inslee. Carrie Lang did an amazing job organizing this clinic, and it was so quick and efficient. We all decided to wear our Somerset shirts to get a group photo of the event to show how proud of our school we are. We all signed up for the same time slot or within 15 minutes of each other. What a great day. So that just does speak so much to the spirit, that I think we're really trying to revive here in the district, as we start to come back together. So it's just a really great indicator. And again, just one of the many factors that come into play, and things that we have to consider as we return, and have more of our students or staff into our buildings. And when you think about it too, learning has continued over this last year in so many different ways, and much of it has been remotely. But in fact, when you think about this and you go back and imagine that nearly a year ago, we were preparing for online learning. We were talking about, getting ready to do some online learning. We started doing some team training. We weren't sure what was going to happen with the pandemic at that time. We were really prepping ourselves, and literally, on 2 days from now, we really will be talking about the day we made the decision, around, shifting, closing our school buildings and continuing learning another way. And, our staff, over this last year have risen to the challenge together. You think about everything we've been able to accomplish over this last year. Bellevue's been very fortunate to already have the secondary laptop program in place, and a lot of our curriculum was online. But, we added, devices for our youngest learners. We really did a great job, I think, in trying to outreach and change the type of services for our students who need them. The amount of meals, I wish I had a specific number, but it's hundreds of thousands of meals that we've provided to our families and our students during this time, and it's going to continue. We've really been thinking about how we can provide better social emotional support for our students and staff, and, really trying to key in on, how we can support the well-being of our students during this time, as well as the academic instruction for our students. And so it really has been pretty amazing to see what we've been able to accomplish over this last year. And, we're not through it yet. We still have a long ways to go, but we've been able to do so much. So I'm so incredibly proud of what has been accomplished during this time. And it just speaks to when we really choose to have a common focus, what we can do when we come together.
Yeah, and me too. I'm so proud of the work that, all of our educators have done to be able to support our students, whether at home learning or learning here in our buildings, and the types of services that we've been able to provide. And, I know we have more collaboration that we're going to be doing here coming up on the horizon. While we're planning more vaccine clinics, I know we're also reaching out to staff to let them know about some other vaccine opportunities that our community partners are having. I know that Kaiser Permanente and the Office of Superintendent of Public Instruction, they're working on that Get Ready vaccine program. So I know that a lot of our staff members have been sharing with each other, and our nurses have been sharing with staff how to sign up, even if you're not a Kaiser Permanente member, so that they have even more opportunities to go get vaccinated, which is really great for people to have options. And I know that, getting those opportunities for people collaborating together to make sure that we can get as many people vaccinated as possible is really going to be a critical tool in helping end the pandemic.
Yeah, so speaking about that, so what is next for our clinics? What's our plans, moving forward? I know we've been able to do a couple of them. I know they've been super convenient. People have been really, really grateful to have them. So what's next? What are we thinking about?
Yeah, sure. So this week I have been talking to 4 different community partners about planning new vaccine clinics for our staff members. I can share about 2 of them that we have pretty close to confirmed. So we're definitely having a second shot clinic on March 20th for the people who got the Pfizer dose back on February 27th. Safeway, again, will be hosting that with us. SEIU will be helping support organization for that. But Safeway has also asked for additional Pfizer doses. So it's possible that if they get that allocation they've requested, we'll be able to offer another round of Pfizer first doses for our staff members. So just as soon as I hear whether Safeway got those allocated doses, I'll start reaching out to staff and helping them sign up for appointments for additional spots on that Saturday. In addition to that, we've been working in partnership with Allegro Pediatrics and Lake Washington School District. Allegro put in a request to be allocated a large number of vaccine doses. We'll find out this Friday whether they were able to get that allocation, and if they do get it, we are planning to collaborate with them on a drive-through vaccine clinic, which will be at their corporate headquarters here in Bellevue. on Sunday, March 21st. So hoping that one goes through. We've been working with Department of Health to see if we can figure out how to get them their doses. We're meeting tomorrow to go over logistics and operations. We're partnering with Bellevue Fire and Bellevue Police, Lake Washington School District, go out there, take a look, see what we'll need to do to make it happen. So if we do get the go ahead with the doses, we'll be ready to go, and I'll start reaching out to our staff members to help them get signed up for that one.
Oh, that's great to hear. Really, really great to hear that. I think the more partnerships we have can be better, because we know these clinics are wonderful, they're convenient, but we know, people can also go out and do their own, vaccinations, with their own doctors or other opportunities that are out there. And just today, I heard that President Biden announced a plan to purchase additional $100 million doses of the Johnson & Johnson COVID vaccine. So I think that's a real important news. So I think we've talked a lot about the supply chain being a little slow, and I heard that that's picking up also, but this new agreement, I think, is going to really ensure that, every citizen has the opportunity to, get protected, from this virus. So it's going to be really, really important. So really good to hear that news. So I'm really looking forward to what else we can do to support us. Anything I think we can do as a district and organization, a partner, and provide this as a resource to our staff is important. Just makes it really easy and convenient. And then, I've been to both the clinics, and it's just been great to see people. People are really happy even being here in the building today. I heard from a couple of our staff members that were there, and they were just so grateful for it. I have heard, a little bit of side effects, and it really does vary on the individual, but hey, that's part of it, So again, I just want you to know, Carrie, just, thank you for your time today, and just know that, we support your work, and so grateful for all that you have done. The nurses have just done amazing work. When the governor visited last week over at Phantom Lake, was able to have, the nurse, share a little bit of information on what's been going on. And, one thing I'll just say is that I just really just saw just how much pride was being expressed in that too, because, we have really done great work, and you've done great work, your team's done great work. And, it just takes so many people that's been involved in this. And like you said, from facilities, transportation, maintenance, HR, so many different people coming together and make all this stuff happen. So thank you for all that you've been doing, and just really appreciate your leadership during this time, and really modeling the way.
Absolutely.
Yeah, you bet. So I want to thank everybody for joining us for this community conversation. Our next community conversation, Carrie maybe join us for that one also, because we plan on sharing more information from King County Public Health, and we're hoping that we're going to actually have one of their staff members join us to talk about some of the risk mitigation strategies that they're seeing, in other areas, and just to, have some more information around, what's going on at the county level and the state level, so we can get a better sense around not only where we are now, but where we're going to be going in the future. So I just want to thank, Bellevue School community members, those of you who were able to take the time to watch this community conversation. Thank you for listening in, and just thank you for all the support that you've been giving to our educators, our staff, and especially, our students during this time. Please continue to connect with, your school staff, administrators, for billing specifics as they are available. And as always, just encourage everybody to stay healthy and safe, wear your mask, still follow all those different risk mitigation strategies that we have in place. We can continue to, provide additional services to our students. But thank you all for all that you're doing, and thank everybody for your support.